Hi there, I'm Monte Eaves. I'm the EBM editor for ASJ, and I'm really excited about all the changes that we're seeing at ASJ related to the incorporation of EBM into what we do. Sometimes people ask me, is EBM really applicable even in aesthetic surgery? The answer is absolutely. There's no doubt, and we're starting to see that more and more as articles come through, as our authors are getting used to the parameters of EBM and what it means, and our editorial board becomes stronger and stronger in understanding and supporting these changes. But don't fear, it doesn't mean that the journal is going to change in a way that makes it less practical. What EBM is really about is getting the best information so you can make decisions about the patient that's sitting there in front of you right then. It helps you really separate what evidence is reliable versus that which may be biased and unreliable due to flaws in the methodology. It's really to help you, because you're going to be able to make the best decisions if you have the best input, the best information going in. So what we're seeing now to help this, the journal's doing, we are really looking at the methodologies of articles very strictly and really going back and working with authors to make sure that these are the highest possible levels. We'd show the levels of evidence. Those of you that may not be aware, the levels of evidence 1 through 5 help really understand the study methodology. Level 1 and level 2, these are your randomized trials. And there's a less chance bias may creep in. As you get into level 4 and 5, these are really the gears of innovation in our specialty. They're very important. But we have to be very careful because there's more potential for bias because they're not blinded or they don't have some of those other methodological tools to really reduce that. So I think it's very exciting what we're going to see changing. I think it's going to give you better and better information. Does this device work better than that device? Is this technique going to be preferable? Which way should I go? And this will really help you as we go forward through the next several years. I think it's just as applicable for people in training to really understand as they take on new techniques as it is for a practicing surgeon in solo private practice, or somebody like me who's in academic aesthetic surgery, really focusing on the academic aspects of what we do. I think it also has a great role internationally to help people that may be barraged by not only their own literature and their own language, but by the language coming out of the United States in terms of the literature, and it really helps you see which are the articles that are going to be the most important and really bring me the most value. And I think the great thing about the way ASJ is doing this is it's really important that we balance the practicality of the journal. ASJ is not an egghead journal. ASJ is a journal that you can take lessons out of every month and use it for that patient that you're getting ready to operate on that day. And I think there's a real commitment to keeping that as we continue to advance the quality of our evidence in the journal.